In this recording, we will briefly discuss some of the common postnatal changes that occur. So first of all, we have the neonatal period, which occurs from birth through the first 4 weeks of the new baby's life. The baby is now capable of performing all of their bodily functions all by themselves. Obviously, there are exceptions if a baby was born prematurely, but we are specifically talking about a full-term normal birth. And we are referring to bodily functions like breathing, eating, waste removal, like body temperature regulation. So the newborn little baby can do that all by themselves now. If the fetal circulation becomes a newborn circulation or just regular human circulation, so we don't need to bypass the lungs, the liver anymore, all that good stuff. We now have fully functioning organs. We are breathing in actual air. The baby is dependent on itself to do that. And so like the fossa ovalis, or the foramen ovale, all of that goes away. We have to go through the heart and the lungs just like an adult would. Some of the other things that are a little different. Respiratory rates and heart rates of newborns are a good bit higher and faster than adults because their little baby organs are a lot smaller, so they just aren't physically able to take in as much oxygen as an adult. Their heart can't fill with as much blood as an adult, and so those functions, they just have to go a little bit faster. Babies are evaluated at 1 minute post-birth and 5 minutes post-birth, and they're evaluated for what's called an APGAR score. The healthcare team is assessing whether or not the baby is adjusting to the new environment. So basically, outside of the uterus, is the baby starting to do all the things it needs to do. And they're looking at a few things. The healthcare team is looking for the skin color. They're measuring the pulse rate, the respiration levels, and muscle activity, and whether or not the baby grimaces. So trying to get that baby to cry a little bit. And it always sounds terrible, but they really are trying to assess whether or not the reflexes are functioning like they are supposed to. So there are various scores, obviously, that you could achieve. We're hoping for the better the score, the healthier the baby. Now, we also have a postpartum period for the mother. So neonatal period was obviously for the newborn baby. Postpartum period is for the mama. This is birth through week 6 approximately. Immediately after birth, endorphins are starting to be released to kind of overcome all the pain and the fatigue associated with the actual birthing process. These endorphins are supposed to help the mom kind of forget about all of that so she can immediately start caring for the infant. Now, in a healthcare setting, obviously, those healthcare workers are there to help mom in any way, shape, and form that mom might need, but her body in and of itself is also trying to help make sure that the newborn is well taken care of. And this is just one of the ways that the body can do that. Now, estrogen and progesterone, we've talked about it several times throughout our discussion of pregnancy and development. These levels now drop significantly after birth because we no longer need to maintain that endometrium in the uterus because the baby's out. Okay. But the downside is the sudden decrease of these hormones sometimes triggers postpartum depression, also known as the baby blues, in some women. So that's just kind of something to be on the lookout for if you are a new mom or if you know a new mom. It's a real thing and it can get really, really bad. So just take care of yourself and your loved ones. Okay. And then respiratory functions, digestive functions, all of the bodily changes that happened during pregnancy are now finally starting to go back to normal. Mom's organs aren't crowded anymore. All the pressure has been alleviated, and now mom's body is only providing for mom's body. And so things get to start working their way back to normal. Now, again, every person is different. Some people go back to normal, it seems, within a couple of days. Some people, it takes a little bit longer. There's no one right way to do things, but eventually all of those functions should return back to pre-pregnancy normal. All right, lactation. We have made the baby. We must now feed the baby. Okay. Now, breastfeeding, we know, is not the only way to feed the baby. Formula is a living, breathing, viable option. It's really not alive or breathing, but it is a viable option. To each their own. We're just going to talk about how the actual breastfeeding process works. Okay, so lactation starts a little bit in that last couple of weeks or month of pregnancy. The estrogen and progesterone levels are going to start to stimulate the anterior pituitary to secrete prolactin. We have previously mentioned that prolactin helps milk production. Okay, so in some women, milk production does actually begin before the baby gets here. Okay, but if we have too high levels of the estrogen and progesterone, it actually inhibits milk production. So there is like a fine line, or like a sweet spot with these levels of hormone. Now, we did just say that once the baby is delivered, the estrogen, the hormone levels decrease. So if they are still too high pre-birth to produce milk, once birth occurs and those levels drop off, milk production should now be possible. Now, the first milk that is produced has a special name. It's called colostrum, and it does have a special makeup as well. This one is very much full of proteins and antibodies. The antibodies are a way for mom to have some passive immunity being passed on to the newborn. Now, once the colostrum is done, the later milk just has a different composition. So instead of being quite as high in protein and antibodies, now we see a little bit different composition. We've got higher fat content. We've got some growth factors. We do still have proteins and antibodies. I don't want you to think that that just stops, but just like the ratios. So a little less protein, a little bit more fat, things like that. All of this kind of acts as a laxative as well to help excrete meconium, which is the baby's first fecal matter. So the first couple defecations of the newborn have a very like dark tarry consistency. That's meconium, and it's a little bit hard for the baby to pass, and so the breast milk kind of helps move things along, if you will. And then so the mom has made the milk. Okay, so the prolactin is there. Milk production has started. Remember, oxytocin, we need that for the actual milk letdown. So if we want to eject the milk from the nipple, we do have to have an increased level of oxytocin. And this whole process will continue as long as milk is expressed, either through breastfeeding or breast pumping. That counts too. But this is a positive feedback process. So as long as the milk is being used or expressed, the hormone levels will maintain the milk production, and we can just go round and round in this cycle until the mother chooses to no longer breastfeed or pump, and then the milk will dry up and the hormone levels will go back to normal. Again, fed is best. We have to fill up the baby belly with something, but now you know how lactation and breastfeeding actually works.